The most dangerous side effect of chemotherapy is not nausea and it's not hair loss. Most people don't know what it is. Hi, I'm Dr. Neema Bhat, Senior Consultant Hematologist, Pediatric Oncologist and Transplant Physician at Therrapie Multispeciality Clinic. Today, I'll take you through the 7 most common side effects of chemotherapy, practical ways to manage each one, and the warning signs that need immediate medical attention. Because knowing when to act could genuinely save a life. Before going through the side effects, it helps to understand why they happen in the first place. Cancer cells grow and divide rapidly. Chemotherapy is designed to destroy these fast-growing cells. The problem is the body also has healthy cells that grow fast. The cells in the hair, mouth, the stomach lining, intestine lining, and the bone marrow are the ones that divide rapidly. Chemotherapy cannot tell the difference between normal cells and cancer cells. So when it attacks cancer cells, it also affects some of these healthy cells, and that is what causes the side effects. Good news is that healthy cells recover. Most side effects go away once treatment is complete. So with that understanding, here are the 7 most common side effects, starting with the one patients worry about the most. Number 1 is nausea and vomiting. This is the side effect most patients fear the most, but it is also one of the most manageable today. Anti-nausea medications have improved a lot over the last 20 to 25 years. For stronger chemotherapy drugs, the oncology team will prescribe anti-nausea medications before the session, usually a combination of multiple drugs. The important thing is to take them exactly as prescribed. Don't wait until the nausea starts. Take them preventively as directed. Eating small, frequent meals instead of large ones also helps. Stay hydrated, avoid strong smells, and if nausea continues despite medication, the treatment team can adjust the plan, so make sure to reach out to them. Number 2, fatigue. Almost every patient going through chemo experiences this. Studies show 80 to 90% of patients report significant fatigue during treatment. This is not ordinary tiredness. It's a deep exhaustion that rest alone does not fix. What does help is gentle physical activity, short walks, light stretching, any movement that feels manageable. Research shows that light exercise during chemotherapy actually reduces fatigue better than complete rest. In addition to light activity and movement and stretching, we can reach back to our roots and our practices and make sure to include at least 20 minutes of gentle yoga, which focuses on stretching and the general well-being as well as deep breathing patterns. What this helps is it reduces the anxiety and also improves the fatigue by focusing on various muscle groups and increasing their awareness, as well as the general sense of well-being is also better. Number 3, low blood counts. Specifically low white blood cells. White blood cells fight infection, and chemotherapy can temporarily bring their numbers down. This is called neutropenia. There is a specific window in each chemotherapy cycle when blood counts drop to their lowest. This is called the nadir. It usually happens about 7 to 10 days after treatment, and during this time, the body is most vulnerable to infection. The oncology team will check blood counts regularly. Sometimes an injection may be given to help white blood cells recover faster, but if there is a fever of 38 degrees Celsius, that is 100.4 degrees Fahrenheit, during treatment, especially during this period of neutropenia, then please make sure to go to the hospital. Do not wait for the next appointment. This is urgent. Number 4, hair loss. Not all chemotherapy drugs cause it, but many do, especially those that are used for breast cancer, lymphoma, and acute leukemias. It usually starts 2 to 3 weeks after the first cycle. The important thing to know, it's almost always temporary. Hair starts growing back within a few weeks of completing treatment. Most patients see full regrowth in 3 to 6 months. Some patients find it useful or helpful to prepare in advance, getting a shorter haircut, a scarf, or a cap. The emotional impact is real, and talking to a counselor or support group can genuinely help. In addition to supportive care and well-being measures, there are also now artificial hair available quite readily in the market. A lot of this artificial hair is actually prepared from other people's hair, or it can also be completely synthetic and looks very similar to real hair. If using these products reduces the anxiety and the emotional trauma, then this should definitely be considered in addition to counseling and social support. Number 5 is mouth sores, also called mucositis. It affects about 20 to 40% of patients on standard chemotherapy. The lining of the mouth is made of fast-growing cells, so chemotherapy can affect it. What helps is rinsing the mouth with plain salt water 4 to 5 times a day, using a soft toothbrush, avoiding spicy or acidic foods, staying hydrated. Don't use alcohol-based mouthwash, which can make it worse. If mouth sores become bad enough to affect eating or drinking, the treatment team can prescribe medications for it. So again, reach out to your doctor because nutrition is very important. Number 6, numbness and tingling in the hands or feet. This is called peripheral neuropathy. Certain chemo drugs can cause it, especially platinum-based and taxane drugs. It may start as a mild tingling and can progress to numbness or difficulty with fine tasks like buttoning a shirt or combing your hair. Most important step is to report it early. When caught early, the treatment team can adjust the dose or schedule to prevent it from getting worse. In most patients, it improves after treatment ends, though recovery recovery can take several months for some patients. The last one, number 7, is appetite and digestive changes. Many patients lose their appetite, notice that food tastes different, or experience diarrhea or constipation during treatment. This varies depending on the chemotherapy drugs that are used. Small, frequent meals work better than 3 large ones. Bland, room temperature foods are often easier to tolerate. Staying hydrated is essential, especially if there is diarrhea. Clinical dietitian can create a strong, robust nutrition plan, and many cancer centers now offer this as part of their standard of care. So those are the 7 side effects and how to manage them. Some symptoms during chemotherapy need immediate medical attention. Do not wait for the next appointment for all your symptoms. Fever of 38 degrees Celsius or higher, that is 100.4, especially 7 to 14 days after treatment, is very important and needs to be addressed immediately. Vomiting or diarrhea that does not stop with medication can lead to dangerous dehydration and also needs to be addressed by the medical team. Unusual bleeding or bruising may mean that platelet counts have also dropped in addition to neutrophil counts, and this also requires immediate medical attention. Sudden shortness of breath or chest pain at any point during treatment has to be brought to the medical team's attention because some chemotherapy medications have cardiac side effects. The most important thing to remember is that chemotherapy side effects are real, but nearly all of them are manageable or preventable. The oncology team is there to help at every step. No symptom is too small to report. For a consultation or any guidance, book an appointment at Therrapie Multispeciality Clinic. The link is in the description. If this video helped, please subscribe and share it with someone who's starting or going through chemotherapy. And please tell us in the comments what other questions do you have about chemotherapy or cancer in general.